lupus is a chronic disease. It's an autoimmune disease, so you kind of fight against your own body, and one of the things that can harm is your kidneys. You get something called lupus nephritis. And so she probably was dealing with this for many years and, amazingly was able to carry on with all her normal activities and, even at a much, much faster rate than many of us. So her kidney disease probably just started to get much worse, I would say probably in the, recent past until she actually needed a kidney transplant. And now she'll hopefully take a couple of weeks to, a few months to recover. But she's, probably otherwise a very young, healthy person, so the recovery can go pretty quickly. The great thing for her is that she got a living donor transplant, and living donors tend to work better and last longer, so she's in good shape that she got that. Hopefully you get a small incision down like on your right lower quadrant of your abdomen, and she, by the next day or 2 days later, she'll be up and walking and moving around, and I think within a few weeks, she'll feel much, much better, kind of back to her normal self. Well, there's more deceased donor transplants. We still have more people getting organs from people who have died, but we try in every way possible to advocate for more living donors. In some areas of the country, it's about 50-50 now. I think in D.C. it's a little less than that still, but we're always trying to encourage people to find living donors and trying to encourage people to be living donors because we know that has a better success rate. So for her friend, usually she's just in the hospital for a day or two because they do the surgery laparoscopically, which is like a minimally invasive procedure. So she'll probably be in the hospital a day or two. Then she'll be pretty sore and a little bloated for about a week. By 1 week, she'll feel much better, and by 2 weeks, pretty much back to normal. But you can just be very fatigued for a couple of weeks afterwards. And for Selena, it really depends a little bit about how she was feeling going into the transplant. But also, again, she's pretty young and healthy, so I don't know her personally. Well, she'll definitely need a couple of weeks to lie low and just recover and heal because it's an incision. It's a big incision, and it hurts for a while, and you just have to recover. But also, whenever you get a foreign organ into your body, you have to go on immunosuppression, and that's a medicine that cuts down your immune system so you don't fight against the kidney. And in the beginning, you get very high levels of that, and you really have to stay away from huge crowds or other people that are sick. You don't have to hide yourself in a room. You can be in public, but for her, she would really just want to lie low and not be with tons of people early on. Because we always tell our donors that you've got to donate without any strings attached. The more you expect that's going to come along with the donation, the worse things are. So, and we are so successful at having incredibly altruistic donors who just donate without expecting anything afterwards. That's really the mindset that we hope donors have. Otherwise, as you can imagine, it can get kind of sticky after a while. Yes, and I thank you guys so much for talking about it. It's super important, and especially here in D.C., we have a huge population of people with kidney disease, unfortunately, and so we're always trying to educate people about it and trying to reach out and describe the whole living donor process to people.